Often women try to find out how to get those pre-baby bodies back right after they have their kids. So one local doctor says he has improved one mommy makeover procedure. Dr. Kevin Smith joins us this morning to explain. Thank you for coming in.
Yeah, this is exciting stuff. It's really changed over the last few years with some new procedures that we're doing. It's really variations on the old technique. But now we're able to do tummy tucks without using drains. And one of the most exciting things is there's a new medicine that we inject that really does a lot to take care of and decrease pain afterwards.
Because that's what you hear so much about, right?
Yeah.
I remember watching the John and Kate +8 after she had her tummy tuck, after having all those children, and she could barely stand up because her abdomen in particular was in so much pain, which you say isn't as much of an issue anymore.
That's right. Because during pregnancy the muscles stretch, the real key with the tummy tuck is to tighten those muscles back up so they're effective when you work out in the gym.
So you have some pictures here to show us, and we want to see some before and after so people kind of get a look at how this actually works and the results. The results are dramatic. I mean, that stomach on the right-hand side, on our right-hand side, I mean, that looks like that is a stomach that's never had children. How do you make this happen?
Well, basically, we make an incision hidden in the bikini line, lift up the skin, repair the muscles, pull the skin down, take out the extra, and stitch everything back up.
So how do you get it to look that good above the belly button too, though? You see, on that stomach, I mean, all of the skin looks completely different and flat.
The skin gets stretched, but when we pull it down and take out that stretch, it's much smoother.
Okay, when we pull up this second stomach, too, I want you to explain, too, because I know I have a friend she's teeny tiny. She had 2 kids. She lost all the baby weight afterwards, but she was like a torpedo when she was pregnant.
Right.
And she always then looked about 4 months pregnant. She finally had to go in and surgically, they say, like, stitch the abs back together almost,
Stitch those muscles back together, exactly.
So how does this work? How is this one different from the first one that we saw?
They're really basically the same. Whenever we see a patient, we look at the skin, we look at any fatty tissue left behind and the muscles, and then adjust how much we do for each one to get these kind of results.
Now, with this, what we're looking at here, you mentioned the new medicine, so
Yes.
it stays in your system for longer and just kind of decreases the overall pain then?
This is like a fancy Novocaine, except it lasts for 3 days. And to get through those 3 days really is a huge difference. We now have ultrasonic guidance, so we can exactly, very precisely inject this Novocaine called Exparel, is the name of the medicine, and that gives good pain relief for 3 days, which allows you to get up and move around. And because you can move, I think the procedure is much safer as well.
Okay, so if we're talking mommy makeovers, we talked about this yesterday too. They keep giving me these interesting interviews because yesterday we talked about this too in a different capacity. Your stomach changes when you have a baby, and your breasts change as well.
Yes, they do. Oftentimes going through that stretch-shrink cycle, you lose volume, you gain skin, so you want to be perky again. Sometimes that requires just a lift where we tighten things up, sometimes placement of an implant.
Now we have a picture of this as well. We can see a before and after here. And explain to me, this is a woman who did she have implants also or just a lift?
No, she didn't. She liked her volume, it was just in the wrong place. She wanted them up on her chest again. So we adjust the skin, we raise the breast, tighten up that skin brassiere, leaving incisions that are hidden in a small bikini top to get back to that shape.
And there she is. Let me ask you this too, because I have a couple friends who have had procedures like this done, and they always say, I want my body back that I had before my baby. And then they get these makeovers done, and I'm like, that's not the body you had before your baby either. That's way better than any body I ever saw on you before. Are you able to get sort of a realistic, if people come to you and say, we talked yesterday about the fact that people now get smaller breast implants and things like that. Are you able to kind of, tailor it to whatever each individual woman wants?
Absolutely. It's all about elegance. It's all about subtlety. It's all about plausible deniability. We want these women to appear that they've just really worked hard in the gym. They just had a little bit of help.
There you go. Well, you appear to have done that. Kevin Smith, thank you for talking with us on behalf of our viewers, their husbands, and of course, Logan Sherrill, our single reporter.